setting up health and social care businesses in 2025 and beyond. There are people who have set up the businesses some 4 or 5 years ago. But as you know, business is an ongoing live process where you can't say, I've set up and I've stopped. You have your agenda, you set up your business, you are registered with the company's house, you get excited, you then get registered with CQC, you get excited, you are still setting up. You get your first client, you are excited, you are still setting up. For most of us here, I am not sure if there's anyone who has managed to just dive into an inheritance of money and just set up. Most of us started from as workers, and you are combining your shifts. Most of you might have been you were the first workers, first employees in your own company. And with time, you have grown to whatever size you have today. So by talking about setting up health and social care business, I'm not only targeting people who are already running. I want you to understand that setting up a business is an ongoing process, because every day, for those who started before 2020, there wasn't the popular issue about COS. And when the sponsored workers came, it was a new chapter in you learning the good and the bad of it. So it's still part of your setting up. So that's what I'm going to be talking about. It's not going to be an academic or familiar or something very beyond what I'm saying. So for the new ones, this is the time we need to talk a bit. And for the existing ones, I would want us to actually contribute to this discussion. And if you look at it, the dom care, which I've heard here, I haven't heard anyone who have said they are running supported living service. The dom care, in terms of the type of businesses which we have, you can see they account for quite a significant amount of money, 11 billion. This is more than the budget of certain countries we might know. But this is just a small sector of the economy generating, and this money is circulating amongst many providers. And I will go into details about this. So what do you think yourself? That's why I wanted to make this a participative event. What percentage of the 11 billion is coming to your business? 1%? Less than that. What percentage of this 11 billion do you really think you are capable of getting? Sorry? You have got the potential of getting all of this money. Here we are talking potential is what is possible when we remove all barriers. Nothing stops you from getting the 11 billion. But here, my topic here is about setting up. And I have said that setting up is an ongoing process. You don't just open, sit, and hope it is going to automatically happen. We've got the dom care. We have only counted 7, 8, 9, 10 providers. To be exact, there are 13,343 registered dom care providers in UK. You are one of, if you are CQC registered, then we have got unregistered private providers. So I want you to take a big picture of the 13,000, you are one of them. And what impact are you making as an individual? So of those 13,000, we have got 641,000 potential clients. And these are only those who are monitored and regulated by CQC. So really, out of 600,000, can you fail to have a portion which will contribute to the 11 billion? I don't know those who are good at mathematics. You'll see on the next table. If we have got 13,000 providers and we've got 600,000 service users, the potential, divide 600,000 by 13, you get 47. So on average, of the 13,000, if each one of you gets 47,000, 47 service users, you will equally share the 11 billion. But is it so? Is that the case? Because I'm talking about the setup, because that is where the mistake and the error starts. Most people wake up and see that George next door is making money in their own imagination. I am in Bournemouth. I want to set up also in Bournemouth. That's all that is driving me. So the error of setting up a business starts from there. We are setting up businesses where we live because we think where we live is where we want to do the business. But the reality is that business is where there is business. Business is not where you are living. So we start to make mistakes where we have a lot of providers in areas where there is no demand. Then we think, because of these 641,000, not all of them are equally distributed throughout the country so that each one of you can get 47, 47, 47. So we want as providers to start, when you are setting up, do your research, do your homework, do the demand. So we want as providers really to understand that it's not about where you are located. AJ here has just talked about knowing 10 providers in Bournemouth. You will see the statistics as we go on. So what I just wanted to make you aware is the availability of business is not dependent on what you think has to happen. As a health and social care provider, you need to notice that there are areas where there is so much demand. And there are areas where they are oversubscribed. So we get a lot of inquiries, how do I do this? So unless you understand where you are operating and the dynamics in that area before you set up the business. We have had people who are very agile. I think we've had one person who came here last time. He was based in Southend-on-Sea. We went and we told him, there is no business in Southend-on-Sea. Go to Devon. On the 3rd of June 2024, they went to Devon. The company is not a secret, it's called Live Social Support. As of March this year, when they sold their company, I want you to look at this. June 2024, they had 0 clients. They went to Devon. They went at the right time, right advice, and took the action. Husband, wife, and children uplifted themselves to go to Devon. March 28, they sold that part of their dom care business with 74 clients at 240,000. And they've now diverted into children's services and supported because that is what they wanted. What I am saying, they were in Southend-on-Sea for 2 years without a client, and they received a notification of decision by CQC to be deregistered because they had been dormant. They went there. So what I'm saying, in 2025 and beyond, when you are setting up a business, look at the demand, be prepared, be agile, and be willing to move. There are a lot of people who spend so much money advertising, LinkedIn, Facebook. If you are in the West Midlands and you are in Birmingham area, I'm not saying don't set up. You are most likely not to succeed because it's oversubscribed. There's no amount of passion which will give you business in that area. Okay, if dom care is not part of what you want to do, we talked about non-emergency transport services. The last 2 sessions, already we have got 3 people whom we have registered. One of them has succeeded and 2 are at interview stage. They are now doing the non-emergency transport service. So one of the issues is just like our African heritage, we are like sheep. If someone sets up dom care, I also want dom care. We never look beyond in other areas. There is an acute shortage of non-emergency transport services, which is those people. We have got a GP here who deals with so many of them, Dr. Brighton here. Some of the people cannot be transported in the normal taxi, Uber, and all that. There is specialized, but their conditions are not such that they need blue light. There is a big shortage there. But it's not a matter of me saying there's a shortage and then you go and dive into it. Again, not preempting because I'm not sure about Brighton's topic, but again, part of what lacks is our leadership knowledge in managing these things. Then when we are sinking in money, we end up making bad decisions. But as you can see, there is a lot working with the NHS, with the prison service, with the justice services. But we are not looking at all that. We are only focusing on DOM. And I mean, I don't know whether there are people from Birmingham outside Danai and Wilson. But what I can say is my research has shown that it's oversubscribed, especially DOM care and supported living. Have you looked somewhere else? Have you ventured just beyond Birmingham? Are you prepared to go up north? Then we've got the children's services and supported living. We don't have a supported living provider here. It's not by chance that we don't have. Most of it are barriers to entry. Children's services, I think we have someone who's going to present about children. We've got very few children's services and we will talk about it. So here I'm just making you aware that in setting up our businesses, we need to be looking. This is just the calculation which I've already talked about. But now, let's look at these statistics. It's very important before you set up your business or wherever you are, you need to go back and research. We have talked about that. You can see the number of estimated service users in the top 3 regions of the country. Northwest, London, and Southeast. Estimated providers. If you don't know how many providers are in an area where you want to jump in, how are you going to be competitive? But something strange is happening here. Can you see the statistics? While the national average is 47, but the biggest area provider, they are 21. If you have got 21.4, obviously there's no 0.4 per person, 21 to 22 service users. That is the average of all these providers. That's the average number of service users. So if you are in your region and you are still falling way below this, you've got a long way to go. We wouldn't know how you are surviving. Because one of the issues, because we woke up in the morning and we had a walk along the seafront, and I was talking to my wife and I was saying, one of the issues which we just face is that we have our business. We don't have a 3-year, 4-year projection to see. Because if you have got less than these numbers, depending on your costing, and you stretch it over 3 years, you might think you have got a business, actually you've got a hobby. But because you will not be looking at the dynamics and the finances. So when you are setting up the business, this is the statistics which you need to know. Or if you are already set up, it will give you an idea of how to benchmark your business within the area which you are living. If we just look at most of these things now, whilst we are talking, the government is talking of all these things. For me, you can do your own research. This information is very academic. It doesn't represent the reality. There are so many people who don't have jobs, but statistics, constantly government is saying there's shortage of staff. How many DOM care providers are really looking for contracts? And they're not getting the contracts. But at the same time, the government is saying there are so many service users and there are no companies to cover. I wouldn't know your own personal situations, but we also run a DOM care service. Our own, we've got challenges in that when we talk to the local authority in Hereford, they tell us they cannot talk to us because we are not on their framework. One. But when the packages come, there is the preferential. You remember I was talking about the sizes and the 641,000. Of the 641,000, 70% is controlled by 10 companies. If you are a DOM care or within in average, whichever sector you are, 10 companies control 70% of the business. So which, if you are not in the